Well, recently we talked to Dr. Sonya Spencer about the new thing that they're doing here at Spencer Chiropractic. It's called BrainCore therapy. Well, I wanted to find out a little bit more about it and actually be tested myself. But if you would, Dr. Spencer, tell us again about BrainCore therapy and what it does.
Well, BrainCore therapy is a neurofeedback, and it all begins with what's called a QEEG. A QEEG is the test that we're going to be doing on you today. And people typically get neurofeedback for a variety of conditions. Some of the conditions they would choose neurofeedback for are ADHD, anxiety problems, stress, chronic pain, memory, PTSD, and those types of conditions.
Yeah, three of those you hit on the ones that I put on my,
yes.
my questionnaire itself.
And so in going over your history and so forth, your history is a match for some of the conditions that would respond to neurofeedback. Neurofeedback has been around for a long time and has been studied in all the major medical universities and so forth, and has been available clinically in office settings for the last 10 years. There's never been any negative reported side effects from neurofeedback. It's safe and effective. So it all begins with the test that we're going to be doing, and I'm going to explain that to you today, how we do the test. This is the cap that we put onto your head, and it contains several different sensors. And these sensors are going to detect the electrical currents that are coming out of your brain, and they're going to send some feedback into our database. What we're going to be doing is mapping several different points in your brain, 12 to be exact, that are shown here in yellow. Now these points correspond to what's called global dysregulation. All of these different points mean something in your brain and control various things about your brain. And also we look for what's called global dysregulation of the alpha, beta, theta, and delta. All of those different types of brain waves control different aspects of what's going on in a person. When those brain waves become dysregulated, it can cause a variety of symptoms, just like the ones we've previously discussed. This is a non-invasive test. There's nothing that's harmful or...
There's no electricity involved here. You know, don't think it's a shockwave thing.
No.
One question, you talk about how it maps out, you know, women and men, they say are the right brain, left brain thing. How does it affect that differently between men and women?
There is no difference between the men and women. Everyone has what's called normative data of how the brain should work, and brain waves work in certain hertz. And so we know what a normative data is, and when we get this information in, it's sent into a database, and you're compared to a normative database. So for example, the lower and slower brain waves, such as delta and theta, are going to occur when you're trying to sleep at night. So you wouldn't want those occurring while you're trying to you wouldn't want an abundance of those while you're trying to get your work done during the day.
Right.
You wouldn't want to be nodding out. And those are more frequent in babies. You see that babies spend a lot of time sleeping during the day, during their first 6 months of life. So
they have budget nights sometimes.
Yeah, but they have an abundance of those particular brain waves. So, and what we do is see if you have dysregulation in the 4 types of brain waves, where those brain waves could be dysregulated in your brain, and better yet, how we can correct those. It gives us a different protocol. It gives us protocols to correct the brain waves. Another interesting dynamic to this is this QEEG is the gold standard for neurofeedback. If you're getting neurofeedback without having this done, and you're just going on a symptom base, like say a person just comes in and says, hey, I'm having anxiety, let me get neurofeedback for my anxiety, and you haven't performed this, and you don't know the particular sites that are dysregulated, you're just guessing. So without this gold standard, which this is the gold standard for neurofeedback, you're just, guessing what's wrong with the patient. So this is the gold standard.
Well, when you do this, because you had me do this before, we'll do the test here soon. But when you did this, I had to go online and fill out a questionnaire.
Absolutely.
And it asks you all kinds of questions, asks you your symptoms,
Right.
what problems you're having. And I had to sit there and think about it for a little bit, because when I think of symptoms, I'm thinking, oh, do I have a pain in my back or something like that, pull muscle? But it's nothing like that, really.
No.
It's all mental and
It's all
emotional.
Mental and emotional. Because if you think about the brain is very complex, and it controls our emotional or our limbic centers. It also controls, things to do with anger, depression, those types of things. If the brain is not working correctly, then it causes those types of symptoms to occur in people. Memory problems, you saw some of those types of things.
Yeah, that's one of the things that I mentioned when I fill out mine is, I can meet someone, hear their name, introduce them, within a few minutes, I'll forget their name. I'll remember their face for the longest time, but their name, sorry, nothing personal, but I just can't do it.
Exactly. And so there's certain parts of the brain that correspond more to memory and more to different types of symptoms. Disorganization. Lots of people have problems with organization, getting things organized in their life, and so forth. I was talking to, this morning I was talking to a person who's a coach for a basketball team. People get overexcited when they go to make that last free throw that could win the championship. This type of, because the brain gets overexcited and doesn't know how to handle all the brain waves coming to them. This type of neurofeedback is actually used in peak performance for athletes who are, trying to make that winning shot without having their brain get overexcited.
A lot better than steroids or something like that.
Absolutely.
Or
because when the brain
drugs.
is calm, you work better. You work better when you're not responding to stress through the over-sympathetic stimulation. And this test is $150, and it's not covered by insurance. So I want to stress that, and Medicaid, Medicare does not cover this. It's strictly cash-based, but it's well worth it if you want to find out if you have dysregulated brain waves.
Well, I'll tell you what, we've run out of time today, but come back next week, because I'm going to have the test done on me and see what kind of issues that hopefully, I'm sure, this can help, and how easy it is. So thank you again, Dr. Spencer. I look forward to it. Going to get hooked up. This BrainCore therapy coming up in our next edition, our next visit with Dr. Sonya Spencer at Spencer Chiropractic, located on Pash Road in Gulfport.